The way we think about eating disorders really has changed in the last 3 or 4 decades. When I was in training, we had a sense that this was a set of illnesses, anorexia, bulimia, some connected eating problems that were largely due to the way that a young girl was growing up, her relationship with her parents, difficulties about becoming independent, and lots of concerns about self-esteem. Now, there may be elements of that actually have some validity, but increasingly we now understand eating disorders, as we do many other mental and behavioral problems, as fundamentally brain disorders. There does seem to be a genetic factor at work here. It's not, though, as simple as saying, well, you've got a gene for anorexia or a gene for bulimia, in the way that we would say you have a gene for sickle cell or a gene for something like Huntington's disease. Here we're talking about something quite different. The genetics here don't cause the disease, they set you up for risk.
This is an area where we know 2% of what we need to know.
We're at a very early stage relative to other medical areas. In the case of anorexia or bulimia, we have a pretty good description. We have some ideas about cause. I think we've come far enough to know that some of our early ideas are just flat out wrong, which is success and progress of a sort. But what we don't know is really what are the most likely causative factors, both genetic and environmental, and how those interact. We don't know really very much about what scientists call pathophysiology, that is the mechanisms of disease. We say this is a brain disease, but in what sense? What's going wrong in the brain? Where, how, when? We don't know all of that, though we've got some early leads, and there's lots of opportunities here because we have such good tools to understand brain function. The third place, if you think about cause and mechanism, is treatment. And oddly enough, I think some of the most hopeful signs of progress are on the treatment side, even though we may not understand as much as we'd like about how this happens.
Bite hard.
Brain stimulation, known as DBS, a revolutionary brain surgery pioneered at Toronto's Krembil Neuroscience Centre. It's given her a new lease on life. While deep brain stimulation is a promising treatment for anorexia, Dr. Lozano says more research is needed to advance our understanding of the brain.
Only about half of the patients actually increased their weight. And so I think we've made a first step into this complex disorder using neurostimulation surgery, but we have a long way to go.
Studies or experimental ablation describes the method of deliberately destroying brain tissue or making brain lesions, so a wound or an injury, in order to observe the changes that this might have on an animal's behavior. So for lesion studies, we're studying brain function by purposefully destroying parts of the brain and then studying the resulting change in behavior. And the main idea here is that the functions that can no longer be performed after the damage are the ones that were controlled by those damaged regions.
Conventional RTMS paradigms include low-frequency RTMS and high-frequency RTMS. During low-frequency RTMS, stimulation is given at a low frequency, typically about 1 pulse per second, and this is done for anywhere between 15 and 30 minutes. On the other hand, high-frequency RTMS uses much faster pulses, typically 10 or 20 per second, and this is repeated for 2 to 4 seconds. Between these trains of 2 to 4 seconds, there is a rest period of about 20 seconds.
Some scientists say that they have come up with a way to turn off the part of the human brain that's responsible for morals. Some people may have had that done already. Anyway, you know, the difference between right and wrong, it's the part of the brain that controls that. And they use this technique called transcranial magnetic stimulation.
This is an area where we know 2% of what we need to know.
In a fully functional human post-accident, that people started to notice this medical miracle. Bigelow's follow-up report in 1868 focused on the mental manifestations of the accident, saying he had become fitful, irreverent, indulging at times in the grossest profanity, and manifesting but little deference for his fellows.